Hey guys, it's me, Richard. This is my imaginary patient lesson plan presentation. Hope you enjoy. I'm going to start off talking about our patient. His name is Archibald Berkshire. He's a 26-year-old male who presented to the ER with marked shortness of breath and increased work of breathing. He is 6'2" and 180 pounds. His heart rate at admission is 112, respiratory rate of 28, SpO2 87%. Breath sounds were decreased and were accompanied by bilateral wheezes. His ABG showed a pH of 7.29, CO2 of 58, PaO2 of 61, and bicarb 25. X-ray showed hyperinflation in all fields, hyperlucency in all fields, and a flattened diaphragm. Patient stated that current condition started after standard household chores, and he became increasingly short of breath after only minor activities. He stated he had significant phlegm production along with a hacking cough for several years now. He also stated that he has moderate year-round allergies and that he suffers from chest colds and upper respiratory infections frequently. He denies smoking, any drug use, and admits to only drinking socially. Patient is unable to provide adequate family history because he was adopted. Patient lives with his wife but has no kids, and his work history includes insurance sales. Over time, patient was stabilized by a handsome new grad in ER. I wonder who that is. With oxygen therapy and judicious use of bronchodilators. Patient was moved to an adult floor for observation. Current vitals are heart rate of 88, respiratory rate of 14, and SpO2 of 96%. His current ABG shows 7.38 for pH, CO2 of 48, PaO2 of 86, bicarb of 25. Current X-ray, hyperinflation in all fields, hyperlucency in all fields, and a flattened diaphragm. Patient is stabilized, cooperative, and resting comfortably. So the patient was confirmed to have alpha-1 antitrypsin deficiency because of the alpha coding test. The physician would like us to teach the patient about the alpha-1 deficiency, what the disease is, how it'll affect him, what treatments are indicated. So anything from bronchodilator therapy, steroid therapy, and augmentation therapy. He would also like us to provide information regarding pulmonary rehab. Alpha-1 antitrypsin deficiency. It is when there's a lack of protein in the blood called alpha-1 antitrypsin, or AAT. The liver produces AAT, and the main function of AAT is to protect the lungs from inflammation caused by infection and inhaled irritants such as tobacco smoke. So don't smoke. So some signs and symptoms of alpha-1 antitrypsin disease are the following: shortness of breath, wheezing, chronic bronchitis, recurring chest colds, exercise tolerance lessens, asthma that can't be completely reversed with aggressive medical treatment, year-round allergies, and bronchiectasis. So as a respiratory therapist, you're asking yourself, what am I supposed to do with this patient? Well, first of all, you got to teach the patient and family about bronchodilators. This patient is going to be on bronchodilators for the rest of their life. So you got to teach them how to properly use the SVN, MDIs if needed. You need to teach them about proper technique. And they have to be able to actually perform it in front of you properly and show full understanding. Same thing with corticosteroids. You want to teach them how to use it, understand it. You also want to make sure that they rinse their mouth after the use of the corticosteroids. Because what could happen is thrush would develop in their mouth if they don't rinse their mouth after using the corticosteroids. So that's one thing you want to avoid. Augmentation therapies, you want to teach them about CPT, how to use proper technique, when to use it, why you use it, what it does to the body, helps cough up secretions, break it up, and everything. Pulmonary rehab is also very important because this is going to be a lifelong disease. They need rehab to keep up their treatments and everything. And one big thing too is also to keep a healthy, active lifestyle. Although their exercise tolerance will lessen, You want to encourage them to exercise as much as they can. Maybe use an incentive spirometer to strengthen their lungs, their diaphragm. But encourage them, if they're a smoker, to quit smoking. Avoid pollutants, anything from air pollution outside, being in casinos, stuff like that. They just want them to live a healthier lifestyle, eat better, don't drink. Good luck, and just be active. Hope you guys enjoyed the presentation. It's pretty simple. Just teach the patient what to do and make sure they know how to do it properly back. And these are my references. Good night.